Elderly clients in massage. Why is massage different? When you're working with elderly clients, be sure to modify your massage for the elderly. You must take into account their health status and any limitations that they may have. You must take into account the aging process and the effects it has on their body. You must also take into account any social and emotional needs, as well as any financial restrictions. By 2020, 17% of the population will be 65 years or older. This population presents us with some very unique challenges. There are physical changes. Some of these are thinning skin, reduced muscle mass. Over 52% of elderly clients will have either vision or hearing impairments or both, and more than 90% of elderly use medicines to control medical conditions, and their side effects must be taken into consideration. This population also has lifestyle and emotional changes. They may be experiencing loss of loved ones. Most are retired and may be dealing with reduced incomes. But it's important to point out that there are no typical 70-year-olds. They can be quite active and independent. However, some do require assistance and may be at home or in assisted living facilities. And some elderly are frail and live in skilled care facilities or at home with family or caregivers. So how does all of this relate to massage? 65 years old is when we must start taking into account the aging process and how it might affect massage. As we age, there are some normal changes that occur in joints and blood vessels as well as the brain. When these cause health problems, they're called diseases. Examples of diseases that occur in the elderly are arthritis, high blood pressure, and Alzheimer's disease. Now, we can group aging into three categories. We can look at those 55 to 64 as older adults, 65 to 74 as the elderly, and 75 to 85 as aged, and then people 85 years old and older as extremely aged. Next, we're going to be looking at some specific physical effects of aging. We'll talk about skin, respiratory and cardiovascular system changes, changes in the gastrointestinal tract, musculoskeletal systems, and the nervous system, and how these can contribute to both impairments and disabilities. First, let's look at the skin. As we age, our skin begins to wrinkle and sag. There is reduced elasticity. The skin becomes more thin and frail. It may tear more easily. It also heals more slowly. There is a decrease in what's called subcutaneous fat. This is fat that's right underneath the skin. You also have an increased incidence of bruising from reduced support of blood vessels, because this fat also supports the blood vessels, and there is a reduced temperature regulation of the skin. In the respiratory system, the ribs may calcify, and this would lead to chest wall rigidity, which also reduces thoracic movements. And in most elderly, there's also a decreased capacity for lung volume. In the aging in regards to the cardiovascular system, the heart often enlarges. Vascular walls may thicken and narrow. There's often an increase in blood pressure. The circulation actually decreases. The person may fatigue more easily, which may lead to dizzy spells. And the dizzy spells also contribute to something called orthostatic hypotension. This would also contribute to dizzy spells. There's also increased varicosities in blood clot formation in the legs. This is especially true with your sedentary clients. Gastrointestinal changes include decreased gastric secretions, slowed digestion, There's an increased incidence of heartburn, or what's called GERD. There's decreased tone of sphincter muscles, and the client may be suffering from fecal incontinence. In the musculoskeletal system, there is often decreased muscle mass, decreased bone mass, decreased strength, reduced flexibility. Your client may be dealing with altered gait. Articular cartilage in the joints begin to erode. The synovial fluid production may decrease. Discs may become more dehydrated and also narrow. And there is often osteoporosis in women and osteoarthritis and kyphosis in both men and women. The next are neurologic changes. This includes decreased cerebral blood flow, nerve degeneration, reduced response time, a loss or increased sensitivity to pain, decreased cold tolerance, decreased balance and coordination, as well as altered gait. Your client also may be dealing with some sensory changes, and these include your pupils may decrease in size, there's decreased cataracts, the walls of the auditory canals may change, and the eardrums thicken, and these incidents may cause visual impairments, which are common, and hearing impairments, which are also common. And the last thing we're going to discuss is the urinary system, and oftentimes there's a decreased bladder capacity, incomplete bladder emptying, which may lead to more urinary urgency. There's also a decrease in the tone of sphincter muscles, which may lead to urinary incontinence.